Hi, my name is Dr. Nina Fertitta, and I'm an OB hospitalist in the state of Louisiana, and I would like to share with you my life-save story. I was on shift when a 24-year-old mother with her second pregnancy of twins presented to the OB emergency department in complaints of contractions. When I was called to the room after the nurse assessment was unable to be completed and she was unable to feel cervical dilation, I was able to examine the patient and noted her to be 8 centimeters dilated and in active labor. I was able to call an urgent cesarean section and with the help of the nursing staff, moved the patient quickly to the operating room where she was placed under general anesthesia for advanced dilation with the twin gestation and the presenting twin being in the breech position. The cesarean section started at 7:24 a.m. and twin A was delivered in the normal breech method at 7:26 a.m. That baby was 5 pounds and 13 ounces, and her APGARs were 8-9. I was able to palpate twin B, and she was in the transverse position. I was able to grasp twin B and deliver her also in the normal breech fashion, and delivery was at 7:28 a.m. Twin B was 6 pounds and 3 ounces. The NICU was present at delivery, but there was only a brief resuscitation with oxygen. Both babies did really well and were able to qualify for the newborn nursery, and we're able to also have care with mom in her room. The patient's private MD was able to join me then in the operating room when she arrived at the hospital after the delivery of twin B. And we were able to complete the cesarean without major complications. She did have a slight postpartum hemorrhage with a blood loss of 1175 cc's, but patient did not require anything to stop her bleeding, and she had normal vital signs throughout. On postpartum day 1, she did require a blood transfusion of 1 unit of blood for a small drop of her hemoglobin from 8 to 6.7, but her vitals remained stable throughout her postpartum course, and she progressed in the normal fashion without any other complications and was able to go home on post-op day number 2 with her babies. I feel the value of having an OB hospitalist on site 24/7 at the hospital was especially crucial in this patient scenario, because with the patient in active labor and the presenting twin in a position that is not conducive to necessarily a safe delivery of that twin, it was imperative that we were able to move the patient to the operating room quickly and deliver the patient and the baby safely. Also, with the second twin being in the transverse position, that is also not conducive to a safe delivery of that twin as well. And there was possibly a very poor outcome of both babies ending up in long NICU stays or even possible fetal death. And instead, the patient got to bring home her babies with her from the hospital and got to have a beautiful delivery story.